So welcome once again, everyone. Welcome to Clinical Skills with Mide Remz. Today we'll be talking about scrubbing, gowning, and gloving majorly in surgery. That is where these activities are most often done. And for the house officer, sometimes you may be asked to assist during the surgery as a house officer. And there may not be so much time for your superiors to teach you how to do these things. So, and the funny thing is, you may get chastised for not getting it right. And however, not to worry, we're here to take care of you, and you learn things gradually as you go. So before you operate on any patient, after a patient must have been worked up properly, and the indications of surgery must have been made, patient has been moved to the theater, then before you lay your hand on this patient, you have to scrub and gown and glove. These are some of the things you do to prevent surgical site infection, or generally speaking, infection, because you still even have to scrub the patient. The scrubbing we're talking about right here is scrubbing of the surgeon and the assistant, and also the scrub nurses. So for scrubbing, usually you should use chlorhexidine. However, in our environment, we use bar soaps. Some people make use of liquid wash. And while scrubbing, you shouldn't touch anything. There should be a soap container that you can, with foot pedals for control, or that you can control with your elbows. So where that is not available, you pick up the bar soap, then wash. You wash from your fingertips to your elbows. When you're using a bar soap, which is the most difficult, as you won't find this anywhere. So with the bar soap, you lather your hands, wash from the fingertips to the elbow, your forearms and your hands. And the difference is you don't drop the soap, you don't drop it at any point in time. So you scrub your forearms, the hands, then you rinse, and that is the first. Then you go the second time, you lather the soap again, then you wash your forearms, you scrub the hands and the forearms, scrub the forearms, scrub well, the hands also. Then you rinse again, and that is the second wash. Then you go for the third time, the forearms and the hand like we did the first time. Scrub up to the elbow, from the hands up to the elbow. Then you rinse, that's the third. Then for the fourth, you wash just the hands. And at this time, for those using bar soap, this is where you drop the soap, then wash the hands. Wash properly. And if you use the WHO method, popularized during the lockdown, the COVID-19 lockdown, then you can do that. However, with this, there's this minimum amount of minutes, minimum amount of time that you should use scrubbing. Then after that, you rinse properly, and you turn off your water, or you have somebody else turn it off for you, and you're done. Then hand down to the elbows, not the other way around. So the water must drip from your elbows. Then you lather again and wash, making the second wash. After that, you rinse again, then you wash again from your fingertips to your elbows. You rinse again, then you lather your hand alone and wash, as shown in the video, wash. Then you rinse with the water. After that scrubbing is done. And it is said that if you have to do more than one surgery, you have to scrub for both or for all the surgeries. The first should not take anything less than 3 minutes. It can be anywhere within 3 to 5 minutes, but not less than 3 minutes. However, the subsequent scrubbings may not be up to that, since you scrubbed before. And after scrubbing, then move to gowning, which is where you dry the washed part, the wet part. The drying, you start from the hands down to the forearms. We dry, so you pick one of the towels. Some of the gowns, usually they have towels embedded in them. So, or you can use a gauze. So you dry the hands down to the forearm. Then the hand. Note that where I used to dry the part of the towel I used to dry the forearm, and the previous hand is not the part I'm using for the second. And you dry the hand before the forearm. Then you discard. Then you come to the gown, unfold. So I can ask one of my good fellows to please tie me up. So gowns are made different ways, but the best of them is the one that you take and make use of without touching the sterile parts. Then you pick the gowns as shown in the video, and you do not touch the outer parts. Gowns usually should have panels to protect you, the surgeon or the assistant or the scrub nurse from body fluids. So you don the gown, someone ties you, then after that you don't touch, as I said earlier, you don't touch the outer part. You move to the gloves. Surgical gloves are turned, their upper ends are turned outside, inside out. So that's where you can touch. You pick up the gloves. You make sure that at any point in time during the gloving, you don't touch the outer part. That's the working part of the glove. You don't touch it. So I'm doing that the same way. You touch the part that is turned inside out. Then for the second one, you're using your gloved hand. You put your hand into the part that is turned inside out. The fold, put your hand inside the fold so that your gloved hand is not touching the inner part or your skin. Then you don the glove. So, and usually you double glove.